How to kidney replacement? A kidney replacement is a procedure to replace the malfunctioning kidney with a healthy one. The kidneys eliminate excess waste and fluid from the blood. Once the kidneys fail to their job, dangerous amounts of waste and fluid accumulate in the body, a state also called as kidney failure. When this happens, kidney replacement is the only option. When a perfect kidney donor is found, Kidney Foundation will call the patients or their family members. Artificial kidney is also utilized if in case you are facing difficulty in finding the right and compatible kidney for you. Kidney experts will check the patients if he or she does not have any health issues. Prior to undergoing the procedure, patients required to not drink or eat, and take all essential treatments. The patient will be assessed fast upon arriving at the hospital. Most of the lab exams at the first assessments might be repeated to make sure no latest medical issues have occurred. A lab test will be performed to make sure the kidney is perfect for the patient. The kidney replacement should be brought out as fast as possible for the higher possibility of success. The kidney replacement takes account of three main stages. First and foremost, an incision is performed in lower tummy, but provided that the kidney is set into place. Secondly, blood vessels from the lower abdomen are connected to the donated kidney blood vessels. This is to give the contributed kidney the needed amount of blood in order to work properly. Last but not the least, the ureter of the contributed kidney is linked to the bladder. A tiny plastic tube known as stent might be injected directly to the ureter to assist make sure a better flow of the metabolic waste and urine. Usually this will be eliminated about 6 to 10 weeks in a while during a procedure also known as cystoscopy. Once the kidney organ is put accurately in place, the cut in the tummy will be clogged with surgical glue, staples or stitches. Even if the kidney replacement looks like an easy task, it is complex and demanding surgery, which normally takes about 3 hours to finish. After the surgical procedure, the patient will instantly begin medication with treatment made to avoid the immune system from refusing the new kidney. These kinds of treatment are called as an immunosuppressant. Once your kidney comes from a living person, it usually will start working at once. 7 out of 10 individuals who undergo this procedure from a departed donor, the kidney starts functioning straight away after the procedure. But sometimes the transplanted organ takes 6 weeks to begin working well. While waiting the new kidney to work, the patient needs to undergo dialysis. Patients can leave the medical center after approximately 7 to 10 days of the procedure. However, the patient will want to attend appointments and checkups at the Kidney Foundation Center in order to check if the kidney is in a good condition. The test is also important to know how the immunosuppressants are functioning. For the initial few weeks after the procedure, patient might require to have at least 2 to 3 weeks of appointments. On the other hand, over time the appointments will become frequent. After 12 months, you need to attend the Kidney Foundation once every 2 to 3 months once you don't have any grave issues. Things to know about kidney replacement. The procedure wherein the not working kidney is being replaced by a new and healthy kidney that come from a living donor is also known as kidney replacement or transplant. Kidney is one of the most significant organs of your body. It is responsible in getting rid of excess water and waste. Once the kidney malfunction, high level of waste and fluid will accumulate that leads to various medical illness. To avoid this, kidney replacement is required. Just one of the donated kidneys is required to replace the 2 malfunctioning organ, making living donor transplant a choice. Once a compatible is not accessible, the patient might be placed on a waiting list to get an organ from a dead donor that takes months and even years. Today, artificial kidney is used in order to replace the malfunctioning kidney. In the Kidney Foundation Center, the patient will be assessed immediately. The previous examination will be repeated to ensure that the patient doesn't have any health problems. A doctor will conduct further laboratory examination to ensure the organ is suitable for the patient. This procedure should be performed as soon as possible for better results. Kidney transplant is composed of 3 phases. 1. A cut is done in lower part of the stomach. 2. Artery from the lower stomach are linked to the artery of the donor kidney. This is to give enough blood to the newly planted kidney in order to work properly. 3. The donor kidney's ureter is attached to the patient's bladder. Stent, a small tube made of plastic, is injected to the ureter in order to help for a healthy and stable flow of the urine and waste. If the operation is successful or the organ in place accordingly, the incision in the lower abdomen will be closed using surgical staples, stitches, or through using surgical glue. Kidney replacement is not an easy task. In fact, the whole procedure takes 3 hours more prior to complete and should be done only by expert. When the kidney transplant is finished, right away patient will start medication in order to prevent the immune system from ignoring the newly planted kidney.
This medication has a medical term of immunosuppressant.
As much as possible, doctors require kidney from a living person as it works instantly after the procedure. According to medical journal, 7 of 10 who undergo kidney replacement which the kidney is came from departed donor, the organ normally starts working at once. Dialysis is badly needed with regard to this instance as transplanted kidney usually begins 6 weeks to function well. After days of surgical procedure, patient can leave the center, but regular checkups is high suggested so as to monitor the condition of the condition and make sure that it is stable and working well. The examinations and checkup is also significant to know if the medication is efficient. 2 to 3 times of checkup is needed after weeks of kidney transplant. This will lessen as the time goes by. After a year, you are requiring to visit the Kidney Foundation Center at least once every 3 months for follow-ups. This is to maintain the good condition of your kidney and avoid further complications as well. Discover important details on kidney replacement. A kidney replacement is the transmission of a properly working kidney from the donor into the patients whose kidney is not functioning well. The main objective of this organ is to strain waste products from your blood and transform it to urine. Once the kidney fails, there is the possibility of building up waste product and water that is very dangerous and life-threatening. 1 kidney is enough to substitute the 2 not working kidney organs. Finding the best and appropriate kidney donor is not an easy process, as a matter of fact takes years to find the suitable one. This is annoying to those who are suffering kidney failure. To alleviate this condition, artificial kidney is the alternative solution. Prior to undertaking the procedure, patient need to undergo various examinations to ensure that there is no existing medical issues. The reason why it might not be efficient or safe to do a kidney transplant having a medical issue is the spreading of bacteria or infections. The surgical procedure is composed of stages. During the procedure, the surgeon places the healthy kidney in the lower tummy and links the vein and artery of the patient to the artery of the new kidney. Then connect to the bladder. Frequently, the new organ will begin making urine once the blood begins flowing in it. So as to help for a stable flow of metabolic waste and urine, stent is connected to the ureter. After placing the new kidney, the cut is closed using various methods. These methods include stitches, surgical glue or surgical staple. Kidney transplant must be done only by specialists as it is not a simple operation. A usual kidney operation lasts about 3 to 4 hours. After the completion of the surgical procedure, the patient needs to undergo medication also known as immunosuppressant in order to put off the immune system from taking no notice of the newly inserted kidney organ. Kidney from a living donor is the most preferred by many doctors as upon the kidney transplant it works instantly. Current medical journal reported that higher number of patients who experience this procedure, their kidney came from deceased donor. Kidney that came from deceased donor usually starts working 6 weeks after the procedure. So in this case, in order to avoid further complications, patients need to undergo dialysis. After a number of weeks of kidney transplant, Kidney Foundation Center allow the patient to go home, on the other hand need to go back to the center for further checkups. This is to ensure that the kidney is working well and in a good condition. Checkups is high commended to determine if the treatment is effective or not. After weeks of the replacement, patients need to complete the desired checkups. After 1 year, patients required to visit Kidney Foundation Center at least 2 times a year to check if the kidney stable and no complication occurred. This checkup is also important to monitor if the kidney is working well in refilling metabolic waste and water.